It's doing it.
Hi, LSMS members. This is Mariah Bowen, your Vice President of Governmental Affairs, and today I'm here with Representative Roy Daryl Adams. Representative Adams is an independent from East Feliciana Parish. His district encompasses both East and West Feliciana, as well as the northern portion of East Baton Rouge Parish. Representative Adams is actually considered one of our more experienced new people because he got to serve for 1 year before the elections, fulfilling an unexpired term of Representative Kenny Havard, who left to be parish president of West Feliciana Parish. So I guess he is one of those new legislators who can talk about both pre-COVID and post-COVID and what it was like to experience your first year with both. So Representative Adams, thank you so much for joining us today. Why don't you just give us a little input on what it's been like to be a new legislator, both before COVID and during COVID.
Okay, thank you. And thank you for having me here today. Post-COVID, it was a learning experience for me because it was my first session, first everything. Didn't know what to do. I didn't even know where the bathrooms were in the Capitol. The joke was the security guard gave me a roll of toilet paper and told me you'll find them. So that's how the bathrooms went. But it was real good. I wasn't on health and welfare my first term. I was on appropriations. No, not appropriations. I'm on it now. I was on transportation. And it was, I got a feel of the land. The post virus was very different. We had to wear masks, you had to sit apart. People couldn't come and really testify and tell you. They could come, but it wasn't as emotional impact as it was the first time. Transportation, they would come and tell you about a wreck their husband was in, wanted to see if we could do something to the roads to improve them. This one, families couldn't bring their kids with them to tell you, hey, my kid needs help with whatever. We need the state, the federal government to step in and help us. So we didn't get that impact. But I knew where they were coming from, but sometimes the impact just you need it. I need it. I think people on the board need it because in Baton Rouge, I don't say this to be ugly to anybody, but I think a lot of our reps, senators are out of touch with the human factor. They overlook the small things in life that really impact a lot of people. And that's why I ran as an independent. I'm not Democrat, I'm not Republican. I'm there for the people. Like I tell everybody in my district, I work for you. You're my boss. If you don't call me and say, hey, we need something, I'm thinking everything's good. And you stepping behind me saying, man, Adams won't do anything. Well, you don't tell me something. You got to tell me. And I'm there and I want to help everybody. I mean, in my childhood growing up, a lot of people in our community kin to me. The medical up here in the country is just hard to get. We had Dr. Piker and he left. I remember we'd drive to Baton Rouge for medical attention. We didn't have it here in the country. I was blown away that some parishes are even worse than East Feliciana. West Feliciana has the hospital, and they do have practicing physicians in West Feliciana. But East Feliciana is kind of, and we do have RKM, we do have doctors, but they are so busy with Medicaid, Medicare. It's hard to get in. It's just hard to get an apartment. So we got to stay in reality and in touch with our people, what they need. Zachary's 20 minutes away, but sometimes 20 minutes is, it might take them 2 days to get that 20-minute trip planned to get somebody to take. So it's just, we got to do better for our people. And that's what
the challenge with those patients is related to being Medicaid recipients and not being able to utilize their benefits well, or with the insurance side of it, not necessarily authorizing what they need in a timely fashion, or both.
It's both. Dr. Wambase, he's across the street here in Jackson on Highway 10, but just to get an appointment with him can take weeks. It's just, he's got just flooded with Medicaid, Medicare patients but it's just hard to get in. I mean, he's just swamped. He's busy. He goes to St. Francisville. I don't know if he goes to Zachary, but he goes to one or the other, either St. Francisville or Zachary. So he's not here all the time. I mean, he's just busy. Doctor, trying to think who's over in Clinton. Well, we have RKM, but it's just, and it's better. You can get in a lot easier at RKM. And then we have RKM at the schools now. Each public school in East Feliciana has an RKM facility, which helps a lot. But just, you know, they are busy.
We hear that from a number of our members, and I know that a lot of the people watching probably have never worked in a rural setting, which is its own unique brand of healthcare, because you have the opportunity to do a little bit of everything. It's not nearly as specialized as being in a specialty practice.
Yes, I mean, very much. I mean, they see it all. They see the broken leg. They see the kid with the common cold, the kid that needs stitches. When I grew up, we had East Louisiana, and it's still here, East Louisiana Mental Hospital, but they would let people come in there to the physicians. And I remember going there as a kid, you know, and the doctors will see you, might give you a stitch, give you a tetanus shot, and then you would go see your regular doctor. But you can't now. We don't have that luxury.
And it's such a beautiful facility too. I certainly hope that the state can find a way to do something with it that maybe can retrofit it and help people up there.
Yeah, yes, very much. And we do have some capital outlay programs going on. Hopefully we're going to get new buildings, but of course that takes time and lots of money, but it is going through the process. So hopefully we will. Mental health is a big problem. We need, you know, we lock up a lot of our mental health patients in jails that they don't know how to handle them. I mean, they just need help. You can't tell them go home and take your medicine, because they just can't do it. They don't do it. They need help, and we need to be there to help them.
I know that has been a theme that has run throughout all segments of society, especially since the pandemic did hit. It's been something that we've seen reports on as it relates to physicians with burnout and being stressed out and just being tired, as well as what we've looked at with students who have been doing remote learning. So I think mental health may be one of those topics that y'all get a lot of information on during this legislative session.
Yes, I mean, it is LSU, the virtual learning. The kids I have parents call every day because the kids are just not getting it. You know, they watch the video, they do, but one went from an A to a C. TOPS, we redid it. So any kid that had TOPS now, they have to write an appeals letter if their grades fell to below the average, B average. But if they can still receive TOPS, but they have to write an appeal because of the virtual learning, which is great. You know, a lot of parents were worried about that. And it's just, yes, it's.
So I don't think, you know, sitting here today, having this conversation with you, I don't think any of us thought that in March of last year, we would still be in the position that we're in today. And not only that, but looking at other variants coming in. So, I mean, I think we're all so hopeful that as we start rolling vaccines through our society, that people will go take them. Even if it's not perfect, it's the best we got right now, right?
It is. And had a big outcry pouring of people wanting to go take. In Jackson, we have McDonald's drugstore. They are providing a vaccine. In Clinton, we have Curry's Pharmacy, and they're doing it. RKM's doing it. And people are going. I mean, it's a big turnout, and they're going. Some have already received their second shot. And people are going. Have some that are hesitant, that are saying, hey, I want to wait a while. But overall, 90% of the people who live in this district are getting shots. West Feliciana, the hospital, and St. Francisville drugstore is giving it, providing it. So
That's good. I'm glad to hear that so many are doing that, because we have heard from other areas where there are, and I think so many people are, sadly, as you are stuck at home, so many people are stuck on social media, and the
yeah,
misinformation that's out there through both Facebook, Twitter, all of those different platforms related in particular to vaccines, but to a number of other healthcare issues as well. It
yeah,
scares people, and that's all they see.
you're right. And nobody's had a bad effect that I know except for Mr. Ronnie Anderson. He had the virus. His second shot set him back, uh, ran a fever, different things. Didn't have to go back in the hospital and lasted about 2 days. He's one, and Mr. George Travis, his second shot set him back because he had the virus. But today they're up moving and everything's going good. So nobody's really had a negative effect from the vaccine, which is great,
It is great. So as we kind of look forward to this next legislative session, you and I both know that we're going to have some tough issues in committee, that are issues that we've seen in the past. What do you feel like you may see that's specific to new types of legislation around COVID? Do you feel like we're going to be looking at public health emergency legislation, or how we handle funding, or anything like that we saw primarily in the last special session that was so contentious?
I hope we had an eye opener, learned a lesson in the first pandemic. Yes, we need to have more control, but, and I hate to say this, but the government gave people, and I'm gonna say in my area, non-working people money, and then they told them to stay home. You can't give them money and tell them to stay home too. You got to, that's
I
not
never
going
thought about that.
not going to work. I mean, we run a business. My business improved. Christmas, December is our best time of the year. It's been Christmas here for the last 6 months.
No kidding.
They've had sales tax, or in this parish, are up, and they're up throughout the state. But they send one signal and they're giving them money on the other hand, and it just don't work. It doesn't work. They got to go. The road, Highway 10, is it just stays busy all night. I run the paper out at 1 o'clock in the morning. Used to not be many cars out. Now people are just going, and I don't know. We got to do better, and I don't know what the answer is, but we got to do better. Hopefully, like the mask mandate, most people wear the mask and they come in the store and they have it on. But you have some, they just not gonna wear it no matter what you do. Right. So I put the signs up. We do everything. Yeah, I want to make $1, but I don't want to make $1 at somebody risking their health. So I ask them, please put on your mask. And if you can't, I can't service you. That's caused some problems. I don't know. I don't have the answers to that, but we need to work harder at getting it. We got to better educate our public. We got to, when the pandemic first started, I was one of them ones that saying this is the biggest joke. And I ran around, I didn't, and I'm ashamed to say that because I really thought it was the flu. I didn't think we were headed where we were. I didn't go to large gatherings. I didn't go, to Mardi Gras or any of that, but I just did not think it was real. I just thought it was the news media throwing something out there.
And I don't think that's different than what most people felt, especially for the first couple of months. Everybody,
Yeah.
To think that we're still sitting here looking at it a year later, it's kind of like if you knew then what you know now, you probably would have found some things to do differently. But I think we did what we could under the circumstances that we were all given to.
Yes, and overall, we handled it good. But yeah, it's just some things I guess we need to fine tune. I don't know. Like I said, the answer. We got to get along. We got to listen to our medical people. I went to Lane Memorial, and the doctors there were in tears. They were crying because nobody was taking it serious. They said that they were just overworked. They didn't and look, it was heart wrenching. You go in there and you listen to them, they see it, they're fighting it. And that was my eye opener that hey, this is bad, and Lane was, they're not a rural hospital, so they didn't qualify for the federal money, and they wasn't big enough as Lady of the Lake, and they were in limbo. In fund wise, they were about to close, and we got together with the congressmen, senators, and got them some funds, but they were hurting because they couldn't do any surgeries. They couldn't do anything during the early pandemic. They shut everything down, and the COVID patients were in the hospital,
Absolutely.
and the federal government at the time was only paying for 10 days, but they were in there for 14 days, and so they were just lost income, and it was working on bad. It hurt.
We saw that with a lot of our private practice physicians as well.
Yes.
Yeah, and a lot of the repercussions of delayed health care with individuals who were just too afraid that they might catch it to continue what they needed to do just for daily healthcare routines. For those who were diabetic, had heart issues, things along those lines, just they were afraid, and so they delayed care, and now that's kind of catching up, and not in a good way.
Yes, and then the people that had heart problems, they were afraid to go to the hospital or see their doctor, so as you said, it's catching up, and hopefully we can solve that too.
Yes.
And I wish the nurse practitioners bill came up this year in health and hot. And my source was my son-in-law. He's a residence doctor. And I called him. Of course, he was against it wholeheartedly. So my vote was no. But
and we thank you for that.
But I wish I'd have had some more input. I didn't have the input. I didn't know who to turn to. I did not know who to talk to. But just questions like that, you need input. Any pharmacy bills come up, Kevin Toombs, he calls me right away. The pharmacy, Dryers and Zachary, all of them call me and give me input on what they see. They're in the field. I'm not. They know what's out there.
And I think that speaks a lot to the fact that you couldn't bring witnesses in. I mean, I remember the one day that I could get a physician into the Capitol, and the bill that he was there for wasn't heard. So I had to channel my inner Dr. Julia that day, the next day, So that had to be one of the toughest components for y'all, to not actually have people there in person to testify and to offer you information. I mean, yeah.
Because that goes along, like I said, when they come and they can give public testimony, it just goes a long ways. To me, it does. It opens doors that I hadn't even thought about. We had Dennis Miller, and I'm not throwing nobody on the rug, Representative Miller. He's a practicing a nurse assistant, and he was for it, and he was, but I needed that MD to tell me just what I needed. Like I said, my son-in-law told me why not. I went with him, and you need it. I need it.
I need to sign your son-in-law up.
Yeah, y'all phone numbers, just anything. Representative Bagley, which he's the chairman of health, and he has a lot of. He said, just follow my lead. Don't. Not that I don't trust him, not that I do trust him. Where are you coming from with your lead? I got to have a little more insight. I didn't really know Representative Bagley at the time. I got thrown in there. I still didn't know him. He told me all about him playing basketball in Southeastern. He guarded Pistol Pete Maravich, and Pistol still got 60 points on him. But it just, I didn't know him, where we were going with this. It just, I have some PAs and as you said, they want to run some bills, and because they want to be able to do more. But I'm old school. I think doctors are number one. Then we go to the nurse and then the PAs. I got to go with what the doctors say until they can teach me or show me something different.
Well, hopefully we'll have some additional and new information. I've spent some of my off time in the last couple of months putting together some research and some, I think personally, some better visuals for the difference in not just the training, but the education.
Yeah.
We spend a lot of times talking about hours and physician-led team care. And I'm not sure that that really resonates with just the regular member of the public, much less with the legislature. I don't know that they understand the full meaning of what that says.
Yeah.
So I'm going to kind of try and change some of the conversation and give y'all some additional information that I think will make it easier for you to oppose those types of legislation. And I'm working on that with my members right now.
See, that's what we need. We need more input. Like I said, they in Baton Rouge, they're out of touch with what's going on in the real world. I'm gonna give you one example. EBT card, which is SNAP card, food stamp card, for lack of a better word. We had a meeting on it, and the old dumb Representative Adams here. I'm sitting there, and they were telling us all the spiel, and I raised my hand, and they called my name, and I said, "Look, I got Joanne comes in my store. She uses her EBT card and buys whatever. And tomorrow Joanne comes in with one from Mississippi. No way, Representative Adams, I can't help him." I said, "Okay." I said, "Well, I got Roy Adams that comes in my store. He uses an EBT card. He's got $1,500 on it, balance left over because they give a balance." "Oh, no, it's no way." Well, the next day I took the receipts because I kept them. We keep them. I laid them on their desk, and she looked at it and said, "We got a problem, don't we?" I said, "Do we have a problem?" I said,
right there. So you do get both Louisiana and Mississippi. Yeah.
Had them come from Texas, same person, but it's just, I don't know, but we are so out of touch, and nobody wants to clamp down on it or whatever you need to do to make it right. Look, I'm all for helping anybody, but let's don't abuse the system. Let's do it because somebody else needs help. They can't get on it because you got too much.
Right.
So we penalizing somebody else for not doing what's right on this side. And medical's a big need. We need medical, need people to go. High blood pressure up here is a bad thing. Some of them could control it with diets, but they don't, they'd rather take the medicine than do the diet, but it's some simple things we could do. And
that goes back to how we educate on health-related conditions. Yeah.
It is, and we need more y'all coming to tell us, just little. It's not major. It's just things you don't think about, and educate us. I got to tell them we don't need to go to a party. Let's be educated.
Right.
About eating, we can eat, but I want to be educated while I'm eating, and tell me something that I can come home and we can use it.
So as you get ready, this is one of those sessions where you get 5 bills. Do you have any legislation out there that you're looking to carry?
Well, I'm carrying some retirement bills for really wasn't for them, but anyway, I'm carrying them for the state police. I'm carrying one for the firefighters. I'm carrying 2 for the city of Zachary, and that's it. We have Appropriations wants us to bring one on any kind of judgments. Say a prisoner, I'm gonna carry one. A prisoner at the state facility gets hurt. Let's look into it. Not just sue the state and tie up a lot of resources to see what we can do to, who caused the fight, what happened. You have to do an investigation, but we don't need a big lawsuit judgment on something like that. But that's it right now. 2 of my bills don't count against me, so I really only have 3 bills going into it.
I'll keep that in mind.
And so, yes, just whatever we need to do. Having trouble giving away my Tulane scholarship. Anybody out there might need it, call. We have a $40,000 scholarship to Tulane. Each legislator gets to give away. The ones in North Louisiana, sometimes they don't even give theirs away. Nobody, they might live in Shreveport, Monroe, but it's an opportunity. It's got to go to Tulane. They got to meet Tulane requirements, but it's for Tulane.
For undergraduate, or does it include postgraduate as well?
Yes, both.
Oh, really? Okay. Well, you may have some takers watching this that
Yeah.
medical school.
Yes, and I've given it away. Well, I gave it away 2 years now. This will be my 3rd year, but it's a golden opportunity for somebody.
Absolutely.
I tried to break it up and give some to LSU, Southern, Southeastern, but they said no, it's got to go to Tulane. So it's
That's the difference in private versus public colleges, right there.
Yeah. It's 105 reps and it's 105 scholarships, and then the Senate gets to do the same.
Absolutely. Well, that's good information. You really may have somebody call you.
Tell them to call.
I will. And I thank you so much for your time today. I know you've got a lot going on in your world to get ready for session. I'm hoping that we find some small semblance of what we're used to.
Yes. Oh, yes. Well, shoot us any kind of information, any kind of bills that are coming up that y'all have the insight. Y'all know, y'all know more than we know. I'm going to say that much.
At least on this subject.
Yeah. And health and welfare. Last year parents came with their kids that the state was cutting their funding. The kids couldn't come, but the parents didn't. And like I said, it wasn't as big as an impact, and they were rushed and hurried because it was a 2-minute time put on, blah, blah, blah. But, just shoot us an email, just something we can read ourselves.
We used to call those the Kleenex days in committee. Those are tear jerkers.
Oh, yes. Yes.
It is.
They told me about it, that before, as you said, they'd come and the kids, the parents or whomever, just eye openers,
It's just exhausting to even watch from the audience perspective, just being in the room. It's so emotional.
Yes. Yeah. But at least it gets more, and you can, we need them.
Absolutely.
Yes, but you need it just to put you back in reality. That we're all made different. But we all want to do better.
That's one of the legislators years ago pointed at him and said, "This is what keeps you human when you sit up here."
Yeah.
It was true. Yeah.
That's right. Yeah. It can wake you up. No, it is. It is.
Well, thank you again. I appreciate your taking the time to be with us, and I certainly look forward to seeing you down here.
Okay. But my number's out there, 225-719-2412. That's my cell phone. Call me. I will call you back. I'll probably answer it, but if I don't answer it, I'll call you back. Leave a message.
If you have anybody who's looking to work in East Feliciana Parish, they can call you about that too, right? You need that.
Oh, definitely. Yes. Yes, we need you. Whatever we can do.
Our PSA at the end, right?
That's right. Reach out to us. We need you. Fine community. People are laid back country, no fast living. Hey, everybody's usually got a big smile and greet you and sit and talk with you for a while.
And they'll feed you too.
Yeah. Right. That is right. So
thank you.
Thank you. Talk to you later.